For your lower body circuit, you can either do this in the water as part of your hydrotherapy, or you can do this standing outside. For this, you're going to do 2 rounds, 7 exercises, and 30 seconds each exercise on each limb. Okay, so working your injured and your non-injured limb. Our first exercise is going to be a straight leg raise. Also, feel free to hold on to something if you are out of the water and you're finding balance is something you're struggling with. Obviously, feel free to hold on to something just to help stability. So the first exercise is going to be a straight leg raise. So from here, you're just working through your active range. So whatever you can achieve, you're going to bring one foot up, and then we're just coming back down. Nice big straight raise, keeping that leg as extended as possible. Obviously, if you're struggling with full knee extension, just working with a range that you're comfortable with there at the knee. So as we're coming up into that. Our second exercise is a hip abduction. So what we're looking at here is trying to take this foot away from the body. So anything abduction is looking to take the knee or the hip away from the body, so away from this midline. So from here, again, hold on to something if you need to, and we're looking at taking that heel as far away as we can, and then back down towards the midline of the body. Our third exercise is a hip extension. For this, again, hold on to something. We're working back into hip extension, so we'll feel our glute is going to shorten as we come back. So into this position, onto that single limb, and we're just going to come into as much hip extension as we can. Nice controlled, big squeeze as we come back, and again, you should feel that glute muscle shorten as you come into that end range position. Our fourth exercise is a knee flexion. So for this, we're trying to get our heel to our bum. So as you normally would maybe potentially on the spot, you'd be bringing your heel to bum. Same thing here, we're just going to do it more controlled, keeping nice and stable, nice and balanced, moving that heel all the way to bum and relaxing back down. Again, if you're slightly reduced range of motion in terms of bringing that knee into flexion, that's fine. Just work to a range that you're comfortable doing. And obviously, if you are in water, you're going to be working with a little bit more resistance on there. Our next exercise is some calf raises. I would recommend holding on to something for this one, just to keep yourself a little bit more stable, and that also will allow to get a bit more range from the ankle. So from here, just up onto our tiptoes, nice big squeeze, and then we're controlling back down, nice big squeeze, controlling back down. Again, working with whatever range you can do at the knee. So if you need a slight bend at the knee, that's fine. Obviously, that's just going to bias a slightly different muscle, so more soleus based rather than our gastrocs. Last 2 exercises, we're going to do a standing march. So for this one, onto that single limb, we're just going to come up, back down, transferring that weight onto each limb as we come onto that one point of contact. Try and have a slight hold as well as you're coming into that top position. And then our final exercise, super simple, just to finish off. Again, good if you're in water working through it, get a bit of resistance, but similar, just really focusing on that work, that walking stance, getting that gait right, making sure that we're functioning correctly through there. Okay, that's all of our exercises for our lower body circuit.